I have found that in the past couple of years I want to be an orthopedic surgeon. I want to be someone who helps, someone who heals what's broken, something that fixes what seems to be impossible to fix. And this is the career that I've pretty much set my mind on. Oops. When thinking long-term and short-term goals, this is definitely a long-term goal. It's definitely one of those that you have to work towards because it's going to be years and years to get to this point of where you want to be. So you definitely will have a 9 to 15 year of education, of needing to have this education and putting forth effort of practicing and then becoming the full-term orthopedic surgeon that I'm wanting to be. Along with this comes a 4-year undergraduate degree at a 4-year university, a 5-year residency program, as well as a 4-year residency program training under a orthopedic full-time surgeon. I would say the longer you work and practice definitely is a gain for your salary, for your reputation, for the patients that you will receive. It shows how much you've worked for this, and it shows how good you are. The steps leading up to this education and career goal that I have are definitely long. First, I have to apply to a 4-year university after high school and get my undergraduate degree. And I'm mainly looking at NC State University for that. And then second, I am hoping to transfer over to Duke University in attempts of attending their medical school and receiving my doctorate in orthopedic surgery. And I think I will be going into residency after that, and finally hoping of opening my own practice, working at a hospital, and just being an orthopedic surgeon. That is my main goal. The duties and responsibilities of an orthopedic surgeon are definitely extraneous. You work long hours, you work hard hours. You definitely work more than a regular American worker. You have to be on call. You have to be ready. You have to be, some things just don't wait. And you have to realize that in the medical field, you can't just wait till the next day and put it off and just wait. Some things you can, some things you can't. You have to be ready. And I think one of the most responsibilities that you have as an orthopedic surgeon or as a doctor in general, you have to consult with the patient. You have to see what's going on. You have to analyze every little detail, the things that they're telling you, the things that they're not telling you, and you have to diagnose them the best way you know how. You have to know what's wrong with them at a split second. You have to know what to do, what the treatment plan is, and the best way and the best outcome for that patient. And it automatically depends on what you know and the experience you have and the adrenaline that's flowing at the time of the incident or rush of getting into what the treatment plan is. The salary of an orthopedic surgeon is definitely great. You have mainly up into the 100,000s. You have your bonus, your profit sharing, your commission, and your total pay. This will definitely depend on where you live, the area, how many citizens there are, etc. And finally, the job outlook for orthopedic surgeon is really good. With the medical field advancing and technology advancing, we need more people, we need more doctors. And getting into medical school is getting harder because of the advancements. So it's definitely one of those things that we need. As the years go on, I do see a decrease in this field only because of how hard you have to work and how dedicated you have to be to this program and how dedicated you have to be to your patients. And I have some pictures for you. Thank you.